Riverside Pain Physicians.
Do you ever experience frequent pains? You know, that uncomfortable feeling can really put a damper on your everyday activities.
But you don't have to suffer through it. Dr. Scott Kramerick is of Riverside Pain Physicians, and he can help you find the best treatment option for your body. Dr. Kramerick, thank you so much for being here.
Good morning. Good morning. Happy New Year.
Yes.
I've dubbed you as the pain eliminator.
I heard that.
You like that?
I like it.
That's a good term. We got to brand that, dude.
We all try to be the pain eliminators. Yeah.
So first of all, for people who might not know, what exactly does it mean to undergo pain medicine? How are you helping people?
Well, we think we're helping by identifying the source of the pain and providing them with a range of therapies that's directed specifically at that pain. We have things that we can do that we couldn't do 10 or 20 years ago. And that's what's so cool about being in this field now. The imaging is better, the medications are way better, and we have some medicines that you can take or apply literally once a week or a time or two a day, take a pill, and get around-the-clock pain coverage. So there's new medications, there's new therapies, there's new types of injections that we can do on people, and everything is now image-guided and super technological. So yeah, we've made a lot of progress in treating pain lately.
And if you can get rid of it, if you can eliminate it, why not? Why live with it?
Right. It's ruining people's lives, their relationships. It's adding to their stress level. It's interfering with their productivity on the job, and it
just spirals downward.
The economic cost of untreated pain is huge. You know, more days of missed work.
Right, exactly. If you don't feel well enough to go out and earn a paycheck, I mean, that obviously is going to put a damper on a lot of things. Real quick, talk about your background to start this kind of practice.
I'm an anesthesiologist, and so for years we were providing anesthetics in the operating room, plus doing what we call regional anesthetics, spinals and epidural injections and nerve blocks for specific regions of the body that are hurting after surgery especially. So we've been able to translate some of these skills to the outpatient world, and we're now treating patients with all these same skills in the outpatient world and injecting things that can provide them with hopefully prolonged pain relief.
Very cool. Now, this is something that came up, I heard the other day, hopefully you can answer this. The term interventional pain medicine. What is that, a real thing, or what is that exactly?
I hope I can answer it. If I can, who could, right? So interventional pain medicine refers to the part where we're doing something besides just giving people a lot of pain medication if they need it. You know, we're providing things where we intervene directly at the source of pain. So using some of these high-tech things that we have, the nerve locators and the ultrasounds and the low-dose x-ray units, we put a medicine directly on the spot that we think is generating the pain. And that's what we mean by interventional.
Instead of just fully medicating somebody and hoping that it'll find its way to that spot.
Right. Wouldn't it be great to go right to the source and maybe burn that nerve, or maybe inject some anti-inflammatory medicine right there, or block that pain? And so that's what we mean by interventional pain medicine. We're trying to intervene right there.
So what kind of patients do you see that come into your practice? If there's somebody who's watching now and they say, you know, I have a X pain, I mean, do you see people who suffer from pains in different parts of the body?
If it's hurting, I can probably help you. People have pain.
Can you do something about this pain?
Yeah. No.
It's in this general seat over here.
It's not in my contract.
No cure for what this brings.
No, seriously though. I didn't mean to interrupt you.
I almost forgot the question. So we try to zero in on the exact area that's causing the pain and treat it as best we can.
Yeah. Like we talked about my father, who has that pain in his back,
and he won't do anything about it.
He is so afraid. He has this shooting pain down his leg. He will not do surgery, but he lives with it. And I keep telling him, like, you don't have to live with that pain. There are things that can be done. But he's the kind of guy that doesn't text, though. You know,
all pains, all places, really from any cause. It can be an injury, an accident. It can be an on-the-job sort of situation. It can be a chronic pain, something that you were born with, something that is degenerative in nature, arthritis. You know, people develop pain as they age. They get deconditioned. All these problems tend to get worse. And so those are the kind of patients that we treat, really. And they come to us from surgeons, from family practice doctors. They refer themselves, their friends, their family call because they've had somebody else seen at the clinic and have good success. And so those are the kind of patients that we see and the things that we offer them.
So let me ask you this, Doc. If somebody's sitting at home and they've got, a mild pain that they're starting to question a little bit, or even something that's very significant, what is the protocol? What should they do? Should they call you and then they come in for a consultation, or what are the steps they should go
Everybody has mild pain, right? And 80% of us have what we would call pretty bad low back pain, for example, over the course of our lives. Everybody's going to get a little something from doing the wrong thing, or chopping wood, or working too hard in the yard, or digging a hole, or whatever it is. Usually that goes away in a couple weeks. But if it's been a few weeks and the pain is starting to do those bad things, interfere with your activities of daily living, drag you down, maybe you're not being so nice to your friends and your family, those are the warning signs that this pain is getting out of control. It's time to come in, be seen by an expert in pain management, and try and get some therapy online so that we can turn the boat around before it gets too far down.
Great.
All right. Dr. Kamarick, thank you so much.
Oh,
we
yeah.
appreciate your time.
Thank
and
you
again,
both.
Happy New Year. From
Happy New Year.
Happy New Year to you both.
I won't give you what I got.
Thank
it's
you.
Not much
That's
of a gift.
great. We appreciate
bad
that.
gift.
Yeah. Okay. Thank you to Riverside Pain Physicians for sponsoring this segment. For more information about pain management, their physicians, and their locations, you can go to riversidepainphysicians.com, or you can call the number there on your screen, 904-389-1010.